think it's partly true, and partly, of course, it's also because it's the fastest growing system of medicine in the world. So according to World Health Organization, it is the youngest system of medicine in the world, and yet it's the fastest growing. It's growing 25% back to back in the last 5 years. And the pharma industry, which you spoke about a little earlier, is growing around 10%. So it's like a 2.5 times more growth. Now, anything which is an emerging kind of a player in the market is always going to have controversy, and there are always going to be people who are trying to put it down. So I think a part of the thing that you read in the media and the part of the thing that you hear is because of this. It's because it's kind of a challenger medicine. Of course, there's a very big gap between allopathy and homeopathy, and it'll take a very, very long time for it to even catch up. But it is growing very fast, and it's already been accepted in more than 100 countries in the world, and it's being practiced legally everywhere. And in spite of all the opposition that you spoke of, which yes, there is some criticism, and it's still growing very well. So I think 50 crore people take homeopathic medicine regularly, and out of these 10 crore are from India. India has the largest number of homeopathic doctors in the world, 200,000 practicing homeopaths, out of which 100,000, 1 lakh are actually practicing. So it has the largest number of colleges. So I think homeopathy in India is very popular. All over the world also is growing very fast. And yes, there is a certain amount of criticism that goes with it, mainly because of the minimum dose that is prescribed in homeopathy, which tried to be analyzed and explained through the memory of water. Because the criticism really is that if it's such a small dose, how does it work? And already there is some kind of research that has been done in Hyderabad, it's been done in IIT Mumbai, which actually proves that even just because we don't have the method to kind of find out very, very small quantities in medicine, today there is technology which can discover that. So what earlier was believed that that it is placebo or is it pseudoscience because it's it can't be determined. Now it can be determined up to a point again. So the higher dilution still can't be determined, which is why in Europe, for example, that homeopathic medicines which are up to say 6C potency, which means 6 times diluted, they are legalized, and beyond that higher potencies, higher dilutions are not legalized. So I think until there is some more research that gets done, and there are so many double-blind clinical trials that have been done in homeopathy all over the world for a lot of problems like asthma, arthritis, and so on and so forth, with very good results. So I think if you speak the language of what is the accepted medical language, which is clinical trials, double-blind trials, evidence-based medicine, which all of us as homeopaths are today doing almost all over the world, I think then the time is not far away when homeopathy will get absolutely recognized, even by its critics. Modern medicine is a misnomer.
Yeah.
Because it is homeopathy that's modern medicine, because it's one of the youngest medical systems in the world. It's hardly 250 years old, much younger than Ayurveda, which is 2000 years old, much younger than allopathy, which is also a few centuries old. So homeopathy is really one of the youngest systems of the medicine. So ideally it should be modern medicine. Number two is it's also a system of medicine. Why I say it's modern medicine, and I'm against the misnomer again of calling it traditional or calling it alternative or complementary medicine. Is also because there are a lot of things which homeopathy kind of put forward much before its times. So for example, homeopathy is based on the systems of likes cure likes, while allopathy is based on opposites. So for example, if you are constipated, then an allopathic doctor will give you laxative so that you get loose motions, and then your motions become normal. A homeopath will give you a medicine which causes constipation in a healthy person. So when you give that to a patient who suffers from constipation, the body reacts in an opposite direction and then gives you normal motion. Now this is very, very similar to the vaccine therapy. So what you call so-called modern medicine is now using as vaccine therapy, a homeopath kind of put it forward more than 200 years ago. So, which is why it's modern. Number two is that today homeopathy is holistic medicine. So you actually talk about, today we all talk about mental health, for example. And it's a very, very huge emerging problem. So what is happening is we are treating mental health as different from physical health, but we are not looking at the body as a whole. So integrated body analysis, where the mind and the body and psychosomatic treatment as we call it today. There are so many psychosomatic problems that appear. So for example, if you get a migraine, It may be because of some stress that you have. If you're getting a backache, of course, it can be mechanical and slip disc and a lot of other problems, but it can also be because of stress factor. So there are so many, so emotional, conditions are responsible for physical problems. Now, this was something which today medical world is recognizing more and more, but it's still treating them in isolation. So you got to go to a psychiatrist to get your mental things sorted out. You got to go to a orthopedic to get your joint sorted out or your backache sorted out, or to a neurophysician to get your migraine sorted out. So it's all dividing the human body into parts. But the human body is not into parts. The human body is one whole body, and every part is interconnected with the other. So recognizing that more than 200 years ago was modern medicine, according to me. So these are just some examples I'm giving you of why I believe that homeopathy is actually futuristic medicine, and therefore homeopathy is what should be called modern medicine, and not old, chemical medicines or drugs which are used, which go through clinical trials, which are useful for the time being, but 10 years, 20 years, 30 years later, you realize that they're carcinogenic, and we then withdraw them from the market. I'm saying if you talk about the drug industry, and I don't want to say anything bad about it because there are also some very good medicines as well which have come out. But what happens is that, things that at that time were believed the futuristic or future of medicine, 20, 30, 40 years down the road, they get banned and they get stopped. Why? Because there's a side effect. So I'm saying that's not really research for the future. That is research for the present. But you need to research for the future. And that is why homeopathy, I think, is futuristic medicine. It is a medicine of our times. And it is something that should be encouraged because it's holistic medicine, it is safe, it has no side effects, it's mind and body medicine, and it can be used for the masses because it's cost effective. So the fact that homeopathy is as drug versus drug, I'm not talking about doctor versus doctor, but drug versus drug. Homeopathy is much, much cheaper, and it's kind of ideally situated for developing countries and for countries which are, kind of on the cusp of becoming developed countries. And therefore, I think more of it should be used. Basic thing is that drug proving, as we call, like what you call scientific drug analysis. Drug proving, we call it homeopathy. It's actually done on healthy human beings. So when a patient actually takes medicine, or for example a drug, a raw drug, a potentized drug really, what happens is when he takes that medicine, he gets certain reactions, he gets certain symptoms. So say he gets constipated, or he gets palpitation, or he gets whatever. But with that also his mood changes. So supposing he then gets anxious, so this becomes a pattern. So then so a medicine, homeopathic medicine made out of that, which is bringing out mental, emotional symptoms as well, which have been clinically proven. When on the symptoms of like cures like the vaccine therapy, like I said, if it is given to a patient who's anxious, who's restless, who has palpitation, that medicine will work as a cure and as a treatment for that patient. So because of the intrinsic nature of proving of medicines, which is done on the emotional plane as well, not just on the pathological plane. It's done on the emotional plane as well. And this is brought about by human interaction. It's not done on rats or guinea pigs. Okay, it's done on live people. So which is why it's more authenticated and it's going to be better used. And again, I said the two things. Number one is it's safe. Number two is that it is non-addictive. So lots of the treatments that are there in mental health, especially drugs, are not safe for long-term use. And number two, they're addictive. Once you get used to them, what we call in homeopathy as well, also in medical science, we call it drug dependency. The body gets used to it and you have to keep increasing the doses over a period of time. And you can't withdraw it either suddenly or even over a period of time. So I think that's a challenge. And then the more, it's a catch-22 situation, because the more chemicals you put in your body and the more need of it comes, then you keep adding on more, and then it leads to a point of no return.